Hi everyone. Today we have final year BME students with us. So these students going to have one case study on infusion pump. Let's start the case study. So hi guys. Shall we start discussing on infusion pump case study?
Yes, ma'am.
Okay. Before getting into this case study, it would be better if anyone give a brief introduction about what is infusion pump and all about, so that it will be fine to continue with the case study. Yes. Anyone?
Yes, ma'am. I'll tell the introduction of infusion pump. So, infusion pump is a medical device that delivers fluid like nutrients, saline, and medications into the patient's body in certain amounts. Like it is widely used in hospital, nursing homes, and even at homes for long-term therapies.
Yes, the infusion pump is one kind of drug delivery system. Not only infusion pump, we have many types of drug delivery system like syringe pump and volumetric infusion pumps and or amplitude infusion pumps and wearable pumps and so on. So now we will go with the case study, I guess. Let's start with the case study.
So the patient name is Mr. Ram and he is 58 years old male and he is diagnosed with colon cancer. So the device used here is a syringe infusion pump.
Is any other information regarding this?
Yes, ma'am. So let me tell about the patient background. So Mr. Ram undergone the major abdominal surgery, so which he required a strong pain relief and then aid recovery. So in traditional injections were considered less efficient and also fluctuating pain reliefs. So in this infusion pump were continuous basal morphine drug delivery, which is useful to break through his pain.
Yes, then what is the major objective, like why we have to use infusion pump over here?
The main reason we are using the infusion pump here is pain control. So this is a syringe infusion pump gives the steady pain control, which helps to improve comfort, and also it allows patient autonomy using patient control analgesic. So the patient will be able to limit how much anesthesia that is coming to him. And also has the machine also has medication levels that is limited to a certain range so that he does not overdose. And also it decreases nurse's workload because the device is an automated device and does not require nurses to be present at all times.
The objective of infusion pump is mainly to reduce the maximum dosage of drug. Now let's have what are the additional features of infusion pump apart from this?
So first of all, it has very high accuracy. That is, it has very error rate of only plus or minus 2%, and also has many alarms like occlusion detection, low battery, and no power input. Extra alarms are there, and also it is powered by the rechargeable battery, so it's very portable. And safety mechanisms include the lockout interval, max dose per hour settings, and also anti-virus features. These are the additional features that are present in the machine.
Any other inputs regarding infusion pump?
Yes,
Like
ma'am.
setting and the programming sites.
Yes, let me tell about the setup and programming. So it has the 5 setups. So first is the drug preparation. So morphine, which is diluted as per the prescription what they have prescribed, it will be diluted as a morphine. So next is the syringe loading. So syringe will be fixed into that pump holder. So third is the priming. It is the air removed from tubing. So it will be removed from the tube which has the air inside it. That. And also it has the programming parameters which includes the basal rate, PCA dose, lockout interval, and then maximum dose limit. So at last it will be the activation. Pump started and then it will be monitored.
I think we were more specific into syringe pump, I guess. Generally, we have a difference between a syringe pump and infusion pump. So, infusion pump is basically working on a principle called peristaltic mechanism. Here, the syringe pump is working on a principle called piston mechanism. So now in this case study we are more related to syringe pump, that's why we are discussing on this syringe pump and then programming settings and everything we have discussed. Now it would be better if anyone discuss what is the workflow which being incorporated in syringe pump. That is a process.
So the process of infusion pump is that pump continuously delivers the basal morphine for the background pain control and the patient presses the PCA button for extra dose if he needed. Then the device records the every dose request for the clinical reviews. It also allows and alarms the nurses or the caretakers if is there any need or any interaction in that.
Okay, then what could be the biomedical engineer role over here?
Okay, let me explain biomedical engineering role in infusion pump. So first is pre-use functional checkup of the pump. Next is battery health testing to avoid power consumption or interruption. So next is calibration as per ISO standards.
It's fine. Now we have come to the end of this case study. What inference we have gained from this case study?
So the outcome is that patient reported the pain score reduction from 8 of 2 to 2 of 10. That is, the pain has reduced for him. Then he is mobilized within 24 hours after the surgery.
So I would like to conclude our case study on the clinical use of infusion pumps in post-surgical pain management. So this case study demonstrates the crucial role the infusion systems play in modern pain management, and it also we also discussed about its accuracy, programmability, and safety mechanisms that make them indispensable in post-operative care. However, effectiveness of the device depends heavily on skilled operation. So if it's not operated by properly trained individuals, it may lead to further risks, and it also needs to be regularly maintained, which is done mostly by us, the biomedical engineers, and also vigilant monitoring to prevent risks. Thank you.
Thank you guys.